Thank you for joining us this evening of this special presentation of You, Me, and MSD. I am Carissa Lacy, the Director of Student Services for the Marion School District. Today, we are going to share how we plan to keep students safe in the upcoming year as questions still arise about the COVID-19 pandemic. We are excited about this coming school year, but we are also committed to opening our schools safely. I am joined today by Nurse Kelly Fogleman, our District School Health Coordinator, and Mr. Hugh Inman, our Deputy Superintendent. Before going any further, I would like to note that everyone in this room has been vaccinated, which is why we can be together without wearing masks. Let me also take this opportunity to thank our Marion Patriot community for your wonderful support over these past several months. We know that these have been challenging times, but we are grateful to have such amazing families in our district who support each other in so many ways. On behalf of everybody in the Marion School District, thank you. We are, of course, excited for the school year ahead and the learning that will take place. We have all hoped that this coming school year would look a lot more normal. In some ways, it will. But the reality is that the COVID-19 pandemic is not over yet. With the Delta variant of the virus spreading quickly and the local vaccination rates low, we still need to take significant precautions to keep our staff and students safe. We are going to share more about those precautions today. Today's conversation is going to be based on the best information we have available. We will continue to follow the guidance of the CDC and the Arkansas Department of Health, and that guidance will probably change at some point. We promise to keep you up to date with any and all changes with videos like this or via our website at www.msd3.org. Nurse Fogleman, when students return on Monday, July the 26th, what precautions will be in place to minimize the spread of COVID?
We will have several strategies in place to reduce the transmission of COVID on our campuses. We want these strategies to be in place to protect our students and our staff and help keep our students in class, in-person learning, because we know that's best for our students. We will first and foremost be promoting the vaccine to those that are eligible to receive it, 12 and older. That's our best way out of this pandemic, is for more people to get vaccinated. So we will be pushing that. We will be hosting vaccine clinics to help our students and faculty get vaccinated. We strongly encourage those that cannot be vaccinated or have not been vaccinated yet to wear a mask when they're on campus. We will continue things like promoting hand washing. We have hand sanitizer available for everyone here. We will encourage respiratory etiquette. We will social distance as feasible in our classrooms, and we will cohort as feasible as well, like keeping cohort grades together instead of mixing everybody up. And we will continue our contact tracing guideline from the Department of Health, identifying positive cases and then removing those people that have been exposed to those positive cases out of circulation to prevent the spread. And the last thing that we will do is have our staff and students screen themselves daily for signs of sickness before they come onto campus.
Thank you. Mr. Inman, if the guidelines for COVID changes, how will parents be notified?
Well, let me start by reiterating what Nurse Fogleman said and encouraging everyone who is eligible to receive a vaccination to please do so, because as Nurse Fogleman stated, that is our best way out of this pandemic. But to your question, we will use our normal lines of communication if there are instances where the guidelines change. So social media, our website, we also have our automated calling and texting system. So all of those methods will be used to push out information.
Nurse Fogleman, are students mandated to wear a mask?
No, students and faculty are not mandated to wear masks. We legally cannot do that like we did last year, but we do strongly encourage masking, especially in populations that have not been vaccinated, and masks will be available on every campus.
Thank you. Mr. Inman, back to you. This is a multi-part question, so I'm going to ask it one question at a time. What will a regular school day look like?
A regular school day this year in the Marion School District will look very similar to what the school day looked prior to COVID. Last year, as you may recall, we ended up dismissing at 2 o'clock in the afternoons. We will no longer be doing that. We will be running our normal bus routes at their normal times. Of course, our campuses dismiss at different times, but ranging anywhere from 3 o'clock in the afternoon until 3:15 or so. But primarily, the day will look as if it did prior to COVID.
You mentioned transportation. Will buses return to normal capacity?
They will. They will be back to where we were, once again, prior to COVID.
Okay. Will classrooms allow for any type of social distancing?
They will allow for some. Unfortunately, they will not allow for as much as maybe we would like in a perfect world, but we will continue to social distance as much as space allows. Again, it just will not be what we might wish that it would be.
Will students eat in the cafeteria and be able to play on the playground?
Yes, again, it will be much like it was pre-pandemic in terms of cafeteria and playground usage.
Okay. With everything returning to normalcy, will students be allowed to take field trips?
We do plan on resuming field trips in the local area at this time. That is something that as guidance may change, we could see that changing as well. But as we are starting this school year, initially we will plan on resuming those field trips again in the local area.
Gotcha. Nurse Fogleman, back to you. As a parent, what preventive measures can I take at home to reduce the spread or likelihood of my child contracting COVID?
The biggest thing that you can do as a parent at home is to make sure that you yourself are vaccinated and the other adults in your home are vaccinated. As well as your children, if they're 12 and older, those vaccines are approved for that age group. That's the biggest preventive measure that you can take, is to get those that you love in your home vaccinated. We hope to have approval for age 5 to 11, maybe approved early fall. But for now, getting those that we know are approved, get them vaccinated.
Thank you. Mr. Inman, will the district continue offering extracurricular activities for students?
We certainly will.
As far as those activities, what will the seating capacity look like at those venues for activities?
Beginning the year, we will be at full capacity. As has been mentioned earlier, we will encourage everyone to socially distance as they can, and we will certainly encourage anyone who is not vaccinated to wear a mask.
Thank you. Nurse Fogleman, you mentioned contact tracing earlier. If my child does contract COVID, what steps do I need to take?
If your child is diagnosed with COVID, I would recommend the first thing you do is contact your campus school nurse, and they will notify me, and I will start the contact tracing procedure. Contact tracing guidelines for quarantine have not changed from last year. Unvaccinated persons that are exposed to a positive case still must quarantine anywhere from 7 to 14 days, depending on some testing criteria. But if you are vaccinated and you're exposed to a positive case in the classroom or school bus or wherever, and you have no symptoms, you're exempt from quarantine. But if your student were to test positive, I would have them contact their school nurse, or I can be reached. I believe my email is below.
Mr. Inman, will the district offer virtual learning opportunities for students that are not vaccinated?
We will not. You know, in the last week, several media outlets in the state of Arkansas have reported how test scores across the state have declined. I think that speaks firsthand to the fact that virtual learning does not work for K-12 students in the state of Arkansas, and we know firsthand that it does not work for our students here in the Marion School District. And so we have made that decision that is different than some districts, but prioritizing educating our students, we have chosen not to offer virtual learning of any kind this school year.
Okay, thank you. Nurse Fogleman, will the district be offering any additional vaccination opportunities, and are there any incentives for being vaccinated?
Yes, the district does plan to continue offering free vaccine clinics in the coming months, and there'll be more information about those dates coming. And the incentives for getting vaccinated for a student would be just number one, to protect their own health and their peers around them every day at school, but getting vaccinated also allows them to stay in the sports that they're participating in or other extracurricular activities, and to be more social with their friends, have a little bit more freedom.
Thank you. Mr. Inman, will visitors be allowed on each of our campuses?
On a very limited basis, due to the spread of the Delta variant of COVID, we will pattern our visitors policy after what we did last school year, which means someone who is wanting to come onto a campus will need to call ahead of time and schedule an appointment. In many instances, they may very well be met out in front of the building, but the key will be plan ahead, call, make sure we know you're coming, and so that the proper accommodations can be made.
Nurse Fogleman, you also mentioned screening your child at home. Talk more about what parents need to do for that screening process.
Yes, parents, we need your help in this. We are asking that you screen your child for any signs of illness prior to sending them to school, on the school bus or dropping them off. We're going to be using the same screening tool that we used last year, and that can be found on our website. In addition, the Delta variant, I just want to speak briefly about the symptoms related to that. Last year, one of the high-risk symptoms was loss of taste and smell. The Delta variant seems to be starting more of like a runny nose and maybe a sore throat, followed a couple days later by a headache and fever, and maybe even some nausea, vomiting, diarrhea associated with it. So symptoms may be a little different, but just watch for any signs of illness. Don't send your child to school if they are sick, and see your local healthcare provider and consider testing if any symptoms appear. I also want to mention that because the pandemic is not over and we have this highly contagious variant here, we will continue our sick student protocol at school. If your child becomes sick at school, they will be sent home for any signs of illness that we feel especially are high risk, and we'll be asking you to see your healthcare provider before your student can return to campus.
Okay. Mr. Inman, I think this is going to be our last question, but we will open it up for any other comments you all would like to make. If my student is quarantined, will the work be sent home electronically or in paper form?
We will actually be following the makeup work policy that is in our student handbook this year. So this will be different from what occurred last year when we had teachers posting complete lessons online. What we will be doing this year in terms of communicating those lessons, teachers will be posting lesson plans in their Google Classroom. For those who do not have access to internet or a device, they can reach out to the school, call the school, and ask for the plans or the packets of work to be put together. In terms of the timelines for students to make that work up, our policy states that students who are absent will receive 1 day for every day that they were absent, plus 1 additional day upon their return to school. So in other words, the clock doesn't start ticking until they return to school. We obviously will encourage parents, whether the absence is COVID related or not, to get the work into the students' hands as soon as possible, and as soon as those students feel up to doing that work. And then it would be great if it was ready to turn in upon their return to school, but there will be several days that they can get that work completed.
Right, thank you. This concludes my written questions, but I would like to extend an opportunity for you all to make any other comments that you would like at this time.
I will just start, or I guess end, with where we started. I don't think at this point in time anyone could overemphasize the importance and, quite frankly, the necessity of anyone and everyone who is eligible to be vaccinated to do so as soon as possible, because again, that is our only way out of this pandemic and our way back to what I'll call a normal life.
Thank
And I
you.
will echo Mr. Inman in promoting those vaccines and that being the end to this ordeal. But I also just want to speak about masks really quick. I really want to encourage our parents, especially in that 5 to 11-year-old range, please consider masking your children at school. And even if you are a vaccinated teacher, staff, student, if you feel more comfortable in a mask and protecting yourself in that way, I certainly encourage it.
Well, thank you. Thank you again for joining us for this special presentation of You, Me, and MSD. Have a great evening.